Does sugar cause cancer? I've had so many patients throughout the years who have cancer seeing their oncologist, and when they ask their oncologist about diet, the oncologist tells them that really has no effect on the outcome of their cancer, which I know sounds very strange, but after you've heard it 100 times from patients, you know that the oncologists are telling patients this type of myth. Now, what about sugar? Patients ask oncologists, does sugar cause cancer? Well, most patients report to me that their oncologists tell them that no, sugar has no effect on their cancer and not to worry about it. Eat as much sugar as you want. And so just the other day, I had a patient, a lady with metastatic breast cancer, and she was just starting her cancer therapies with her oncologist, and she asked her oncologist about sugar. And he told her again, sugar has no effect on cancer. Eat as much as you want and just maintain your weight with whatever foods you want, even sugary foods, because weight maintenance is very important when you have cancer. Well, then she came in to see me and we discussed this more in detail. And I told her, of course, diet affects your cancer. We have many, many studies demonstrating that people's susceptibility to cancer is related to their diet for sure. Now, think of cancer as a fire and think of sugar as a type of fuel or gasoline added to the fire. So if you have an existing fire, which is caused from whatever the cause is in the body, that could be many different things. There could be toxins you're exposed to, high stress, medications you're on. There's many different causes of cancer, but let's just say the cancer is going on and there's a fire, so to speak, in your cells and tissues. And so sugar really is analogous to like fuel added to the fire. It does not make sense that if you have a fire going on, you add fuel to it. You want to take away the building blocks of fire. So the way this works metabolically in the body is insulin resistance. Now we know about 50% or more of the adult population in America has prediabetes or diabetes. They have cardiometabolic syndrome. And so basically you have insulin resistance. And this occurs when the cells are becoming resistant to the hormone insulin. And insulin has the function of transporting glucose into your cells. So when you eat a lot of simple carbs or sugar, your insulin goes up and your body can transport it into the cells so it doesn't stay in the bloodstream where it's toxic to things like your brain and your kidneys and your liver and so forth. And so insulin is a good thing. It's a good hormone, but when insulin levels are too high for too long of a period of time, during a time period, then that actually acts as a fuel source for cancer. If you pick up any textbook on cancer, and when I've taken courses on cancer, we have these big, thick textbooks, and you'll see the hallmarks of cancer. And in there, you will see that insulin is a tumor promoter. It is carcinogenic. And this is the reason why people who have diabetes have higher cancer rates. When people with type 2 diabetes who have major insulin resistance and their insulin levels are spiking, then we know that promotes inflammation and it's tumor promoting. So this is the connection. So yes, while it's true that sugar doesn't directly cause cancer, we know that it indirectly causes cancer because high insulin levels over long periods of time fuel cancer growth. They're tumor promoters. So that's where these oncologists are wrong. And they should know this because they do understand that people with diabetes are at higher risk for cancer. So this is why it's so important to avoid simple sugars, just for general health, but especially if you have cancer or have a history of cancer. You don't want to be eating high glycemic foods in the refined state. So a lot of the breads, pastas, crackers, cookies, fruit juices, these are very problematic for your insulin levels. This is why I recommend a lot of patients eat a modified Mediterranean diet. What does that mean? Well, it's a diet high in fruits and vegetables. It's high in nuts and seeds, legumes, has cold water fish, say like wild salmon, for example. It has lower amounts of poultry, small amounts of red meat, and this is an insulin balanced type protocol. This will fight insulin resistance, and it's good for the immune system. By the way, the Mediterranean diet has been shown to have cancer protective properties. Other people like other diets. If you have some excess weight, a ketogenic diet obviously is going to be very good in terms of combating insulin resistance. There's various low-carb diets you can be on. And so it depends on your state of health, your genetics, and how you do with these different types of diets, but we've got to get those simple sugars out of the diet. The other thing to remember when it comes to cancer is that simple sugars reduce the activity of your immune system, your white blood cells. So different immune cells, they've done studies, and when you get sugar loads through, say, soda pops and a lot of simple carbs, then that reduces the activity of your immune system. So that's a problem, obviously, for cancer as well. Well, there you have it. We know that sugar, simple carbohydrates, fuel cancer because of the effects on the tumor-promoting hormone insulin. And this is what you can discuss with your oncologist. This is the reason we don't want people eating a lot of simple carbs and sugars when they're trying to prevent and treat cancer. So for more videos on cancer and diet and other subjects related to cancer, you can see more of my videos on this channel.